Fetal abnormalities of the brain. Number 1. Acrania. Ultrasound diagnosis. Absence of cranial vault and cerebral hemispheres. At 12 weeks, acrania is suspected by absence of the normally ossified skull and distortion of the brain, exsencephaly. At greater than 16 weeks, the brain is destroyed, anencephaly. Number 2. Arachnoid cyst. Ultrasound diagnosis. Unilocular, a vascular cyst that does not communicate with the lateral ventricles. They are usually found in the midline between the cerebral hemispheres, but about 10% are in the posterior fossa behind the vermis. Number 3. Blake's pouch cyst. Ultrasound diagnosis. Expansion of the fourth ventricle into the cisterna magna, resulting in a unilocular avascular cyst in the posterior fossa. Keyhole sign in the transverse cerebellar view. Vermis. Normal size with mild to moderate upward rotation. Cisterna magna. Normal. Differential diagnosis. Megacisterna magna, greater than 10 millimeters, normal vermis. Arachnoid cyst, cyst in the cisterna magna with mass effect on surrounding structures, normal vermis. Number 4. Brain teratoma. Ultrasound diagnosis. Irregular solid mass with cystic and/or calcified components distorting the brain anatomy. Number 5. Cerebellar dysplasias. Ultrasound diagnosis. Transcerebellar diameter less than the 5th percentile for gestational age. The small cerebium is due to disruption in the white matter of either the vermis, vermian dysplasia, or the cerebellar hemispheres, hemispheric dysplasia. Number 6. Choroid plexus cysts. Ultrasound diagnosis. Single or multiple cystic areas more than 2 millimeters in diameter, in one or both choroid plexuses of the lateral cerebral ventricles. Number 7. Corpus callosum agenesis. Ultrasound diagnosis. Absence of the septum, cavum pellucidum, and teardrop appearance of dilated posterior part of the lateral ventricles, teardrop, in the standard transverse view of the brain at greater than 18 weeks. Gestation. Complete or partial, usually of the posterior part, absence of the corpus callosum in a mid-sagittal view of the brain. Abnormal course of the paracallosal artery. The normal length of the corpus callosum at 20 weeks gestation is 18 to 20 millimeters. Number 8. Dandy-Walker malformation. Ultrasound diagnosis. Cystic dilatation of the fourth ventricle that fills the posterior fossa and extends into the cisterna magna. Hypoplasia or complete agenesis of the cerebellar vermis. Number 9. Dural sinus thrombosis. Ultrasound diagnosis. Avascular, supratentorial, hyperechogenic mass in the posterior fossa above the cerebellum, surrounded by a triangular sonolucent area, the dilated venous sinus. Number 10. Encephalocele. Ultrasound diagnosis. Cranial bone defect with herniated fluid-filled or brain-filled cyst. Usually occipital, 85%, but can be parietal, 15%, and rarely frontal. Number 11. Hemimegalencephaly. Ultrasound diagnosis. There is cerebral overgrowth and ventriculomegaly of one hemisphere resulting in shift in the midline in the standard transverse view of the fetal head. The diagnosis is usually made greater than 26 weeks gestation. There are always abnormalities of sulcation, including ageria, pachygyria, or polymicrogyria. Number 12. Holoprosencephaly. Ultrasound diagnosis. Abnormalities from incomplete cleavage of the forebrain observed in the standard transverse sections of the brain. There are 4 types. Number 1. Allobar type. Fusion of the cerebral hemispheres with a single ventricle. Number 2. Semilobar type. Cerebral hemispheres and lateral ventricles are fused anteriorly but separated posteriorly. Number 3. Lobar type. Cerebral hemispheres are separated both anteriorly and posteriorly, but there is partial fusion of the frontal horns of the lateral ventricles, absence of septum pellucidum, and abnormalities of the corpus callosum, cavum, septum pellucidum, and olfactory tract. The main differential diagnosis is septo-optic dysplasia, and therefore an attempt should be made to examine optic chiasm and optic nerves by MRI. Number 4. Scintillencephaly type. The anterior and occipital areas of the brain are fully cleaved as in the lobar type, but unlike this, there is no parietal cleavage, and therefore the sylvian fissures are vertically oriented and abnormally connected across the midline over the vertex of the brain. Lobar holoprosencephaly is detectable at greater than 18 weeks gestation, but the other 3 types can be detected at the 11 to 13 week scan. Number 13. Hydranencephaly. Ultrasound diagnosis. The cranial cavity is fluid-filled, and there is no remaining cortex. The falx cerebri and posterior fossa are normal. Number 14. Lissencephaly. Ultrasound diagnosis. The whole or parts of the surface of the brain appear smooth with lack of development of brain folds, gyri, and grooves, sulci. Prenatal diagnosis is very difficult but suspicion could be raised greater than 24 weeks gestation. The parieto-occipital and sylvian fissures appear flat, and the subarachnoid space is usually increased. In all cases of apparently isolated brain abnormalities, such as ventriculomegaly and agenesis of the corpus callosum, a detailed follow-up scan should be arranged at around 26 weeks to exclude an underlying lissencephaly. There are two types of lissencephaly. Type 1, ageria, with lack of neuronal migration. The cortex is smooth and thick. Type 2, extensive and anarchic migration, with lack of layering. The cortex is described as cobblestone. Number 15, macrocephaly. Ultrasound diagnosis. Head circumference greater than 2 standard deviations. Number 16, megacisterna magna. Ultrasound diagnosis. The cisterna magna is greater than 10 millimeters in the transverse cerebellar view. Vermis, normal. Differential diagnosis. Blake's pouch cyst, expansion of the fourth ventricle into the cisterna magna, resulting in a unilocular, avascular cyst in the posterior fossa. Vermis normal in size with upward rotation. Arachnoid cyst, cyst in the cisterna magna with mass effect on surrounding structures. Normal vermis. Number 17, microcephaly. Ultrasound diagnosis. Ultrasound diagnosis is made usually in the late second and third trimesters. The fetal head circumference to abdominal circumference ratio is below the 3rd percentile, 2 standard deviations below the normal mean for gestational age. There is slopping forehead due to the disproportion of the frontal lobes and the face. In most cases presenting in the second trimester, there is associated holoprosencephaly, or encephalocele, and in those presenting in the third trimester, there are abnormalities of sulcation or neuronal migration. Number 18, parencephalic cyst. Ultrasound diagnosis. One or multiple cystic lesions in the brain that communicate with the ventricles, subarachnoid space, or both. The cysts are either in the fissures or in the midline. There are 2 types of porencephaly. Type 1, unilateral due to hemorrhage or ischemia. Type 2, bilateral due to neuronal migration disruption. Number 19, schizencephaly. Ultrasound diagnosis. Unilateral or bilateral cleft between the ventricular system and the subarachnoid space. In about 70% of cases, the lesion is in the parietal lobe. In 50 to 90% of cases, there are other associated brain abnormalities, including agenesis of the cavum septum pellucidum, septo-optic dysplasia, and severe ventriculomegaly. Number 20, septo-optic dysplasia. Ultrasound diagnosis. Absent cavum septum pellucidum with communicating frontal horns. Number 21, tuberous sclerosis. Ultrasound diagnosis. multiple echogenic nodules in the heart, rhabdomyoma, usually greater than 20 weeks gestation, and brain, cortical tubers and subependymal nodules, usually greater than 30 weeks gestation. Differential diagnosis, cardiac fibroma, which are single, large, and often associated with pericardial effusion. Tuberous sclerosis is found in 50% of cases of rhabdomyoma. In the other 50% of cases, the cardiac tumor is an isolated finding. When there are multiple rhabdomyomas, the risk of tuberous sclerosis is greater than 90%. Number 22. Vein of Galen aneurysm. Ultrasound diagnosis. Supratentorial midline translucent elongated cyst with active arteriovenous flow within the cyst, demonstrated by color Doppler. The defect develops in the early first trimester, but the aneurysm becomes sonographically apparent just in the third trimester. In 90% of cases, there is high-output heart failure with secondary hydrops. Number 23. Ventriculomegaly. Ultrasound diagnosis. Bilateral or unilateral dilation of the lateral cerebral ventricles observed in the standard transverse section of the brain. Subdivided according to the diameter of the lateral ventricle into mild 10 to 12 millimeters, moderate 13 to 15 millimeters, and severe greater than 15 millimeters.